Okay, so Dr. Geller, what new treatments and therapies do you find to be the best for children and adults with autism?
Well, it's important to not only look at therapies that are, quote, for autism, but to understand the components of what someone on the autism spectrum presents with so that you can address whatever components need to be worked on in terms of an evidence-based treatment for that. So in other words, we're looking at the symptomology and the particular impediments and skills that somebody has when we're deciding what kind of treatment we want to use. And we don't need to limit ourselves to only treatments that have been specifically tested with double-blind research. It's not necessary because we can look at people who share common issues and look at the evidence base for those issues. So for example, one of the biggest problems that is presented to me by individuals on the autism spectrum is often dealing with aggression. So, and by aggression I mean both physical aggression and verbal aggression. A problem like that is something that makes your school placement or work placement or home at risk. If you cannot handle your aggressive behaviors and interactions, you will not be able to live with a high quality of life in the world. So aggression is a really important problem. So is there a, quote, treatment for aggression of people on the autism spectrum? No, there's not. So what can we do for people on the autism spectrum who present with either verbal or physical aggression? We need to understand what are the causative elements to the behavior. Is the reason the person is aggressive because he has very inflexible thinking, he's upset by any deviations from expectation of things that happen around him, as do happen in life? Is that the reason that the child is pushing away a teacher or screaming in the middle of class when he shouldn't, or acting in some other aggressive way? What is the reason for that behavior? Is the reason that the child's always missing what is being said because they process auditory input very slowly or differently? Is the reason that the child has had traumatic experiences at school, on the bus, with children or teachers, and so that when something that seems small to someone else happens, it's big to that child and that child reacts explosively? Is the reason for aggression that the person is odd and different and that other people who are more socially savvy are bullying that individual, and the only one getting caught is that individual, and that's the one who's being expelled from school or suspended or sent to the principal's office or can't handle the work environment? So there's lots of reasons for aggression, and there are many evidence-based interventions that can treat some of those various reasons. So like anything on the autism spectrum, we would like to specify the treatment to the actual impediment that is getting in the way of optimal functioning. So if we say the impediment is aggression, and that's endangering their placement, or that's endangering their relationships, then how do we treat that? We have to very carefully look at what the elements are that cause aggression, whether it's verbal or physical. And then when we determine what they are, we can put in place something that has an evidence base. So for example, cognitive behavior therapy, generally speaking, is the more appropriate and evidence-based kind of psychotherapy that we might use with children or adults with Asperger Syndrome or other autism spectrum disorders. If in fact I am misperceiving, because of my Asperger Syndrome, I am misperceiving what other people might be saying to me, then cognitive behavior therapy, where I sort of think about my cognitions about others and thus change my emotional response, may be the most appropriate treatment for that particular individual. If it's about my rigidity and lack of ability to flexibly problem solve, then I may want to look for treatment for that particular reason in the social problem solving literature, and look at how to generate and brainstorm and create other social solutions besides being aggressive. So that might be the particular intervention for that child. If it's that I'm experiencing and re-experiencing something from a trauma situation that I've had in the past, then I want to look at a maybe dialectical behavior therapy type of approach to deal with my overreactivity based on trauma. If I, in fact, am having aggressive behaviors because I'm being bullied, and the older children get, and I'm including adults here, the older children get, the more subtle bullying becomes. We have bullying at school, we also have bullying in the workplace. And it may be that the person who's done the unpleasant bullying then is not noticed, and the person who reacts with an outburst is noticed and suspended or fired. So I want to know how to handle that bullying situation. School-wide programs and industry-wide programs have a little bit of an effect on bullying. But what we really have to do is help the person understand why they're being bullied and what they can do. And it's not just to ignore the situation. That person might need assertiveness training, for example, and that might be the best evidence-based treatment for that individual who's being bullied. Because bullies find people who are unassertive and who are passive and allow themselves to be bullied. Sometimes bullies will choose as a victim the person who does a little bit more in the way of outrageous behavior. And they'll choose that person because they'll do something outrageous and make a fool of themselves or create some kind of outburst. And so that kind of a person needs to learn how to present themselves in a little bit maybe more socially appropriate way. So for one person I might do assertiveness training, and for another I might do social skills training looking at how they show themselves to the world. So there's a whole range that I just discussed of reasons for someone to be either verbally or physically aggressive, but it depends entirely on what the picture is of causation for us to understand what is the proper evidence-based treatment for that child or adult.